Hello and welcome to Listen.Up.People, a podcast of the USC Dworak-Peck School of Social Work. I'm Dr. Eric Rice, Professor and Associate Dean for Research. 58 million Americans are 65 years old or older. Over the past decade, as baby boomers have reached retirement age, we've seen a 40% increase in the number of aging adults. My guests today are part of the Interprofessional Education and Collaboration for Geriatrics, a USC program which is transforming the way that services are delivered to the older adult population. I'd like to welcome my colleague, Dr. Joosten-Hagye, teaching professor and coordinator of interprofessional and team-based education at the USC Dworak-Peck School of Social Work. She's joined today by her colleague, Dr. Tatyana Gurvich, associate professor for clinical pharmacy at the USC Alfred E. Mann School of Pharmacy and Pharmaceutical Sciences, a geriatric clinical pharmacologist and clinical preceptor at USC Mann UCI Medical Center Senior Health Clinic. It's wonderful to have you both here today to talk about this important topic. I love to start these podcasts off by asking folks how they got involved in the work, right? So maybe we can turn to you first, Tatyana. Like, how is it that you got involved in wanting to do this kind of work?
I've been in geriatrics for over 30 years, and I trained at USC. And when I did that about 30 years ago, interprofessional education was in its infancy. And so I received a very interprofessional training in my residency program. I worked in a similar group of people: physicians, social workers, psychologists, occupational and physical therapists, speech therapists. So I received my training in an interprofessional environment,
Yeah.
and I've been lucky enough to work in that kind of environment. When I joined USC as faculty, I realized this program existed. It was just such a natural transition into this. And so I bring all this experience and background into it. And I think all of us on our team are well versed in interprofessional care. And so that's why it's so much fun. It's my
Oh, that's
passion.
great. That's great. Dawn, how about you? How did you get involved in this project?
Yeah, so similar to Tatiana, I've got a little over 25 years of experience working as a medical social worker and in geriatrics. And when I was working on my doctoral degree over at UCLA, I started as a fellow in team-based education in a freshman cluster called the Frontiers in Human Aging, and fell in love with team-based interprofessional education. And then once I came over to USC, I immediately started linking up with other colleagues across the health sciences, and was introduced to the IECG program and IPE Day here at USC.
I would imagine most of our listeners who tune in to hear about a variety of different topics probably don't have a lot of knowledge about the IEGC program. Maybe the two of you could give us some of the highlights about what it is that you do, the mission, and who you serve. And maybe we'll start with you, Tatyana. Maybe you can give us a little bit of an overview, and Dawn, you can also contribute to this as much as you feel.
So this program has been in existence for over 10 years. It involves 7 professional schools across USC, and we're really lucky to have this breadth of education at this institution. So we have pharmacy, social work, medicine, occupational therapy, physical therapy, psychology. We had dentistry at one point.
It's a lot of schools.
Yeah, all these schools get together and they provide students from each school. And it's a 6-month program that we teach where the students are broken up into interprofessional teams, with each of them having a lead faculty person attached to them. And we go to seniors' homes throughout Los Angeles, and we visit them on a monthly basis over a 6-month period. And each time we do a home visit, we explore different areas of what each discipline does. For example, we're actually having a session this afternoon, and today's session in this program will involve a medication reconciliation and getting to know the older adult in their home for the first time. And then the next time we'll cover another topic, and we kind of go through each discipline and talk about what each discipline will do with an older adult, and they practice it on the home visit.
When you go to do these home visits, do you have students from multiple disciplines that are a part of the educational I guess, outreach moment in these folks' homes?
So yeah, so each student team has 6 or 7 members, and
Hmm.
there's each profession represented in that. And then there's a faculty person attached to each team, and we each go into a patient's home and do these educational sessions and practice sessions with the older adult while we're getting to know them.
Very cool. Very cool. Dawn, do you have anything that you wanted to add to that about your experience in this program so far?
Yeah, I think Tatiana summarized it really well. The program emphasizes these didactic interprofessional trainings, and then there's this experiential learning that happens when they go in these home visits with the older adults in low-income housing units. And the beauty from the perspective of a social worker is we're seeing the person in the environment, and we're able to see what we learn, all of us learn about social determinants of health. And those become really apparent when you're in someone's home and you see the community in which they're residing, and you see their level of functioning as well. So it creates this really unique opportunity for students to immerse themselves in the environment in which the individual resides, and that's a real strength of this program.
Yeah, it sounds like it's a fantastic opportunity for people to see a variety of different perspectives. And that actually makes me think of something I've been told, Tatiana, that you like to refer to healthcare for older adults as a team sport. Can you tell us what you mean by that phrase?
Sure. All older adults are fairly complex, psychosocially and medically. From a medical standpoint, they kind of accumulate medical problems over a lifetime. So
Mhm.
it's not uncommon for them to have multiple comorbidities, multiple medical conditions, physical limitations, psychosocial issues, and so traditionally, the care people receive primarily comes from a physician, right? Well, they can't possibly address all of these concerns in a single older adult. If one person is only taking care of that older patient, a lot of things fall through the cracks. So, this is the opportunity for all of us to get together and kind of provide our expertise for each of the problems that present themselves. It's very
Sure.
much a team sport, and we need each other to provide better care. And the older adult needs all of us to receive that care.
Yeah, it seems like there's I suppose, a sort of humility in having different disciplines come together and acknowledge that they need one another in order to do this work and do right by any one older adult whose life is so complicated. I think one of the things I've been interested in interdisciplinary research for a long time myself, and I definitely have seen similar sorts of dynamics play out where you have much more ability to address problems when you have these variety of perspectives. One thing I'm interested in picking your brain about, Dawn, a little bit is the role that social work plays in this, because I don't think that a lot of people think about social work as maybe being a part of health sciences or a part of maybe these interdisciplinary teams. And maybe you can address a little bit about how it is that you see social work fitting into this.
Yeah, absolutely. Thank you for that. So, social work is important to include in collaboration of health science professions because we have expertise in the micro, meso, and the macro systems, as well as I mentioned, the person and the environment. So, we are often the profession that health professionals will make referrals to when they recognize that they have an older adult who is experiencing challenges like maybe with housing and finances and transportation or food insecurity that's interfering with their ability to manage their health conditions that they're being treated for, right? So, with that piece of it being global assessors, we're really key in being able to address not only those, but also any kind of emotional types of needs. So that the whole biopsychosocial, spiritual, cultural model,
Mm.
right? Advocacy and improving access, all of those types of things to really help improve any of the disparities that are being experienced, especially among vulnerable populations.
Yeah, that's such an interesting thing for you to bring up. I think social work in some ways, and I think pharmacy too, and I'll get to this in just a second, are disciplines that people have very stereotypical ideas about what those disciplines might be about that may not reflect the richness of the experience of what the disciplines bring to the table, and this idea of being this holistic assessor role that social work plays is such an important thing. And, our school for the last few years, we've had an interim dean that is also the dean of the School of Pharmacy. And he's made me much more aware, Tatyana, of the way in which I think we misinterpret pharmacy, right? That I think a lot of people have this very one-dimensional view of pharmacists as being the sort of person that you see at a chain drugstore. But really, when you are going out into the community like this, your role must be very different than that. Can you maybe tell our listeners that are maybe more in social work what it is that a pharmacist does in especially this kind of context?
What I do is I go into a home, and home visits are really important for pharmacy as well, because you get to see where all these medications are being stored and
Mm,
how much of these how many vials are there of prescriptions. You get to look in the medicine cabinet, the bedside, to see what all the over-the-counter medications the patient is taking. One time we went into one of the senior housing apartments as part of this program. And we were actually talking to a patient about nutrition. It wasn't time to talk about meds. And he was saying, he doesn't have enough money for food. And so we immediately went into his kitchen to see what he was taking and opened up his pantry and found literally a pantry full of herbal products.
wow.
There was no food in there. It was just herbs, supplements, thousands of dollars worth of supplements at that point. And so those kinds of surprises are really relevant to what I do. So when I collect all the stuff the patient takes, we have a conversation about each medication, how they take it, whether the patient knows what it's for. I ask about common side effects that these medicines can cause. I screen to see if the patient has them. And then I look at the medical condition, the dose, whether or not they're tolerating it okay. And either, depending on the setting, in this setting, I would just make recommendations for them to talk to their physician about some of this stuff. In my clinic, I actually implement changes to medication regimens and see patients over multiple visits to titrate medications up and down, start new ones, and kind of limit the polypharmacy that happens in the management of older adults.
No, that's so interesting. I think most people don't have a sophisticated understanding of how much, as we get older, there's this variety of medications that were being prescribed by a bunch of different providers, and that there may not even be a person like you who rarely is actually showing up at someone's house to do this sort of this kind of look. I mean, do you have a sense of who the population of the folks that I mean, I know they're aging, but who are the folks that you are going into the homes of when you're doing these visits, and how do they get involved in this program that you all are working on?
Um, so these patients live in low-income housing. Over the years, our program has developed relationships with these communities. Some are in West LA, some are in East LA, some are in LA in general. And so we communicate with them. We make sure that the housing management picks out seniors for us to speak to. These patients volunteer, or these clients volunteer their time, but I think we build relationships with them. And so what we found that even when our students leave this program, they maintain a relationship with some of these older adults over the years and become friends with them. So it's a relationship building activity as well as a learning opportunity for students. And the older adults that we interact with also get useful information about their health care, and hopefully a road going forward to get better care out of their providers and out of their situation.
Yeah. So, Don, I want to turn to you for a second as a follow-up to this last point, which is about these home visits. I know that home visits are sometimes more a commonplace in social work, but can you talk to us about the sort of the importance that home visits have, and what the social work role in those home visits is when you're coming into these seniors' homes?
Yes, absolutely. So, as a member of this interprofessional team, the social worker is, along with the team, engaging and building rapport with the older adult,
Mm.
having conversations with them, noticing any kind of concerns with safety. So, if there's a lot of medications and pills and those types of things, then we may work with the pharmacist and others in the team to be able to help with setting up some type of an organization. And in the past, when I did home health, I would get sheets and have pictures of the medications and help them with writing those down and work with the nurse practitioner of setting that up. So we do those types of things, but then if there's a need for any kind of equipment in the home. So, if physical therapist is and occupational therapy are looking at the bathroom and they notice, boy, they really could use some grab bars or a detachable shower head or a bar next to the toilet, then
Mhm.
social workers will help with, identifying community-based resources to be able to come in and make those kinds of modifications, helping with food insecurity, screening and assessing for loneliness and depression and anxiety. And as it relates to medication, one of the common types of referrals that social workers get as medical social workers are referrals for addressing medication non-adherence, and that may mean
Oh, you're right.
not having health insurance that covers the medications because it's non-formulary out of their network, not being able to make the copayment, or maybe needing to work with pharmacy and the primary care physician to look at other medications that might be in their network that they can actually afford to pay the copayment for. So a lot of times as social workers, we help with making sure they have access as well, any kind of supplies and testing strips and all those other things. So just think of social work being there to really support all the members of the team. And then also, of course, having the older adult as the expert over their lived experience and making sure they're at the center and
Sure.
that we are partnering with the older adult based on their strengths, based on what matters with them to address any unmet needs. So helping them to age in place and have all of their biopsychosocial spiritual needs met.
I want to maybe take this as an opportunity to then talk about the impact that all of this great work you just have described to me has. And I think one thing that's exciting for me as the associate dean for research and somebody who really cares about academic research is when I get to see programs like this evaluated and publications done on it, because I think that oftentimes the proof of the value of a practice-based program like this is how that education impacts the real world and how you're actually able to establish that. And I know that the two of you were the first and second authors on a study that was published last year in the Journal of Interprofessional Care. And I'd love to hear about what you wrote about, and maybe you could describe to our audience the main findings of this study that evaluated the program's impact. Maybe we can turn first to you, Tatyana, and then we'll have Dawn contribute to this conversation as well. But I'd love to hear about what you found.
We basically surveyed participants of this program 3 years after they've graduated
Mm,
and collected the results. Like, how did this program that they participated in as students impact their current practice? And the findings were really encouraging. I mean, 81% of the graduates of the IECG program continue to work in interprofessional teams. 80% reported that their experience in IEGC significantly impacted their practice, and they routinely use the tools that we taught them to use in this program on their patients. We collected multiple really nice quotes about how impactful this program was, how much it taught participants about the others' professions and what they
sure.
do. And I think that it possibly makes their job easier in the clinical world because they know what to expect from each discipline. I have to tell you, these programs are really difficult to put together. I mean, every school has their own requirements for things. Scheduling is different. Getting these students together, like this year, we have, I think, 130 students from different schools, all in one place. That it's very challenging, and every year somehow we managed to do it, and we run it pretty successfully. We started it pre-pandemic with a lot of years of experience there. Then the pandemic hit, we turned it into a completely virtual experience, and then a hybrid one, and now it's all in person again. So we've gone through these phases of history and time, and we've managed to keep it together, and it's grown actually. This is the largest class we've had.
Oh, that's really cool. That's really cool. Dawn, I know that Tatyana just gave us some of the high level findings. Maybe you could give us a sense of, from your perspective, what some of the take home messages from this research were from your perspective.
Yeah, so when we engage in medical education, interprofessional education, the whole goal of it is to prepare this collaborative practice ready workforce, right? So we
Hmm.
want them to be able to take and learn about. So this is the the IECG program, and all IPE programs are competency based. So we have competencies from the IPEC, and all health sciences programs are required to have IPE, and we use these, it's competency based, right? So we're really preparing these students to understand the roles and responsibilities of professionals, to be able to have to engage with older adult partners and their families, organizations, and communities with, with these competencies of values and ethics and cultural humility and responsiveness. All of those things are really, really important. So preparing this workforce is like a real key piece of it. And what we found in our research is that a little over 79% say IPG really had an impact on their daily practice. And that's what it's all about, helping them while they're in the programs be prepared to enter the workforce, to be able to be ready to have that impact their practice. And there's not a lot of studies to date that have actually done that.
I'm kind of surprised to hear that there hadn't been many other studies that did this. Is it because these kinds of programs are so rare, or is it because there's just been a lack of attention paid to actually collecting evidence on their impact?
Yeah, it's probably a combination of both.
Okay.
Yeah, and like Tatiana said, these programs, we spend a whole year planning this program before we launch it, right? So it's very time intensive,
Sure.
and the fact that we had so many of the graduates actually participate in this study, in our study, speaks to the relevance of it, and how valuable it was to them also, right? So we had a good percentage of respondents, that actually participated. So, the value of the program, I think, helps also, because we had like almost a 59% response rate, which is pretty high for 247 graduates that we sent the survey.
Oh, that's amazing. I mean, it certainly speaks to the power of the program that you've got that kind of voluntary response rate, right? I want to make sure that we get a chance to ask you, Don, about a follow-up to this, which is that I know that you're involved in an interprofessional certificate program at the School of Social Work as well. How's that connected to this, and what is that about too?
The IECG program is actually separate from the interprofessional certificate. So
Hmm.
both are open to all graduate health profession students. IECG is a 0 unit credit, no credit course. So that occurs, like Tatiana mentioned, on 6 Fridays between fall and spring semesters. The IPE caregiving certificate requires completion of 4 3 unit courses, one of which is a course that emphasizes interprofessional education and trauma informed evidence based team interventions, specifically focusing on diverse caregivers through a social justice and intercultural lens. So while both provide social work and health affairs students with IPE and team based care and didactic and experiential experiences, the certificate is tailored to better prepare them for working with diverse caregivers versus older adults.
Oh, I see. So it's a slightly different focus in terms of the work that you're training people for, but it's got a very similar character in terms of this interprofessional focus.
Can I add
Exactly.
Go ahead, Tatiana, please.
So I think the other unique piece of this program is that for most of the students participating, this happens in their preclinical years. So I
Mm,
think there's always some interprofessional collaboration when students go on rotation to hospitals, to clinics, because they get together with other health professionals to take care of patients. I don't think that's that uncommon. But this is for, at least for pharmacy, for medicine, it's preclinical. So, but at the same time, it's not just didactic content. They're not in the classroom learning about this stuff without being able to practice it on a client or a patient. And so this is what's unique about it. It is 6 months long, which is very difficult to put together. So that's unique too. There are lots of interprofessional activities that are 6 weeks, one day, a month. This is 6 months with the same person. You really get impactful and meaningful interaction with the same older adult. And over time, students learn from each other.
Yeah, well, it would sound like over 6 months you would get a chance to learn from one another, as you said, but also I think you mentioned earlier that sometimes the students build relationships that endure past the training program with those older adults, which also makes a lot of sense. And I think it's interesting that you point out that some of the other programs that you know of are much shorter duration and probably and therefore much less meaningful. I think it's also great to hear from both of you at the beginning of our conversation how you each had pretty profound interprofessional education experiences in your own training, and that has, it would seem to me, carried through in your career as now people who are training the next generation to do this kind of work that clearly you were inspired by when you were doing your training.
I learned to talk to a patient from a social worker. When I was a student and a resident, I would go on home visits with a nurse, a social worker, and me. And I watched that social worker interact with a patient, and that's how I learned to talk to patients. I mean, it was an amazing experience that I carry with me.
No, that's incredible. I mean, I love that. I had a similar experience in my early training when I was a postdoc, hanging out with social workers, that they really changed the way that I interacted with people and thought about things too. Their social work it has some pretty amazing tools for engaging with people, but I'm also sure that likewise pharmacy has amazing tools for engaging with people that social workers learn from as well. It's these interprofessional education environments are always these collaborative, reciprocal places where people learn. I think I want to close out with any last thoughts that you might have for our listeners about lessons learned from doing this interprofessional education, or from your own experiences doing this kind of work that you think would be worthwhile sharing with folks. Maybe I'll start with Dawn and then let Tatyana, you close us out. Dawn, anything you want to share with our audience?
Yeah, I think just in listening to both of you talk, coming back to what interprofessional education is, it is learning from, with, and about others together, right? So it's not coming in uniprofessionally, right? So this holistic lens is key. Going out into the community where our clients, where our patients, where people actually live and reside, that's going to become increasingly important in being able to really address population health in a meaningful way, because our clients don't live in the office. Our clients don't live in the hospital. They don't live in the clinic. They actually live out in the community. And when we're able to go out into the community, we're able to just see this whole different type of perspective, and really hear what's important to, especially when we're talking about older adults, what's important to them, what matters to them, and then to be able to meet them where they are and partner with them, right? So this is that partnership of us as clinicians and them, as the person. And that's the important piece of it, is being able to listen, hearing what their narrative, what their needs, what their preferences are, and being able to have that culturally responsive types of approaches, is especially in these diverse communities and populations surrounding our campus, right?
Tatyana, some parting thoughts for our audience?
I think interprofessional education is part of every health professional program requirements. And a lot of this stuff is just a box to be checked off. So some of the programs that are out there aren't as meaningful as I think this is. And so, we have to continue to look for these long-term, thorough, in-depth kinds of programs that actually teach students something that they carry with them. One challenge we faced over at least the last couple of years is the lack of funding, and so I think health professional schools should really prioritize programs like this to see that they not only succeed, but are able to continue. Having interprofessional centers, or having an interprofessional center at USC, would be wonderful, because it could house a program like this and many others that haven't even been developed yet. If we're going to move our professions forward and education forward, we have to think more globally, more interprofessionally, and I hope the right people are listening.
I'm sure some of them are. I'm sure some of them are. Well, thank you so much, Don and Tatyana, for doing such incredible work out in the community and also taking the time to talk to me and our audience today about this work that you're doing. If you, the audience, would like to learn more about the IECG as well as the research happening at the USC Dworak-Peck School of Social Work, you can visit our school's website at dworakpeck.usc.edu. And if you have questions for the guests on our show, or you want to support our transformative research and programs, you can email us at Listen.Up.People@usc.edu. And let me just say thank you one more time to both of you. It was absolutely fabulous to have you both here today.
Thank you.
Thank you for the invitation.